Hey there, my name is Dr. Jeff O'Boyle. I'm a family medicine and addiction medicine doctor in Ann Arbor, Michigan. My clinic, Beyond Primary Care, is a direct primary care clinic. That means I'm entirely insurance-free, membership-based, where I offer my patients virtually unlimited office visits, wholesale medication dispensed from my in-clinic pharmacy, as well as wholesale blood work done at the time of the visit if needed. Today, I want to make an educational video for my patients as well as a greater community in general about breathing assisted devices, specifically nebulizers, such as what you see here and these devices here and here, which are great for kids. Nebulizers are devices that aerosolize a medication into a mist that can be inhaled into the lungs. Nebulizers are great for people who either one, are incapable of using an inhaler, two, cannot take deep enough breaths with whatever breathing device they're using, or three, have certain medical conditions such as asthma, COPD, or other shortness of breath conditions such as the seasonal influenza or flu, or the current coronavirus going around with this COVID-19 pandemic that's affecting our country and our community. Nebulizers are super easy to use. This is the device I use here in my clinic. This device here, this kitty and this dragon device are also nebulizers I have out to loan to my patients in case them or their children need assistance in breathing, and hopefully we can avoid an unnecessary trip to the hospital emergency room and those unnecessary costs. In addition to the nebulizers I can loan out to my patients, I also have pulse oximeters that I can loan out to my patients, and we can see your real-time oxygenation status as it's running. Nebulizers are super easy to use. There's 5 main components with each nebulizer. You have the nebulizer or the air compression device itself. That's going to have a cord that's going to run into an outlet. Okay. You're going to have tubing, which is typically about 6 feet long. You're going to have your medication cup. You're going to have your mouthpiece, and then you're going to either have a lip piece or a mask that attaches onto the mouthpiece. Okay. To get started with a nebulizer, you're simply going to plug the tubing into the nebulizer right over here. You're going to take the other end of the tubing and plug this into the medication cup. You're going to take the mouthpiece and turn this on, turn this in a clockwise fashion to secure this to the medication cup. And again, using either the lip piece, such as this, or the mouthpiece where you just insert it directly there. And the masks are great for either adults who cannot use the lip piece or children who cannot use the lip piece either, where it simply just goes around their head like this and it forms snugly against their mouth, and they get the aerosolized, the misted medication that way. Okay. To use the nebulizer, you're gonna unscrew the mouthpiece in a counterclockwise direction. You want to hold the medicine cup in an upright position the entire time as not to avoid spilling the medication or interfering with the aerosolization of the medication itself. The medication is oftentimes going to come in a pre-mixed single-dose vial such as this. Again, you're just going to unscrew the medication cap. You're going to insert the medication into the medication cup like this. You might have to give this a couple squeezes to get all the medication out. Okay. Again, you want to make sure you hold this cup in an upright position the entire time. Make sure you don't spill anything. You're going to screw the mouthpiece back in a clockwise fashion, and then you're going to turn this on. And breathe into the device. A typical breathing treatment with a nebulizer lasts about 10 minutes long. Okay. If you're using a medication with a nebulizer that requires a steroid, you want to make sure after treatment you brush your teeth thoroughly. Once you are done with your 10 minutes and the nebulizer treatment is complete, you're simply going to remove whatever lip piece or mask that you're using at the time, unscrew the mouthpiece, and then unscrew the or take off the medicine cup from the tubing, and these can be washed with warm water and let to air dry until your next treatment. So again, my name is Dr. Jeff O'Boyle with Beyond Primary Care in Ann Arbor, educational video on how to use a nebulizer. Thank you so much for watching. Have a great day.